is just a huge honor for me today to be podcast interviewing Dr. Allan Coopersmith and Nathalie Fiset, all the way from Montreal, Canada, Montreal, Quebec, Canada. Now, I want to tell my listeners something. There's no commercials on this program. I contacted these two people. They did not contact me. They're not paying me for anything. I'm just trying to bring you the best quality information I can, but I'm going to read you off their website. This might take a minute or two, but I think it's worth reading. Dr. Allan Coopersmith practices cosmetic and general dentistry in Montreal, Quebec, Canada, and together with his wife, Nathalie Fiset, who's a hygienist, invented the PerioTwist interdental cleaner and delivery device. Dr. Coopersmith graduated with the gold medal from McGill Dental School and went on to complete a general practice residency program at Albert Einstein Medical Centre in Philadelphia before returning home to set up his dental practice in 1976. He is a fellow of the Academy of General Dentistry, Academy of Dentistry International, International College of Dentists, Canadian Academy of Restorative Dentistry, and Prosthedontics, American College of Dentists, International Academy of Dento-Facial Esthetics. His motto is to educate, motivate, and facilitate. He and his wife are passionate about educating people to take care of their oral health, which significantly contributes to their overall total health. Because gum disease starts between the teeth, they want to motivate their patients to clean between the teeth. The problem is that current products such as floss, picks, wire brushes have many drawbacks and limitations, creating non-compliance. They want to facilitate oral hygiene and provide patients with a cleaning tool that is easy to use, efficient, economical, environmental, and that's why they spent the last 12 years developing a tool that will be the simple solution to this very complex problem. High-tech design is 12 years of research and development invested in developing a tool that is simple to use, convenient, affordable, senior-friendly, multi-purpose, effective, comfortable, and reusable, and leaves you with the fresh mint taste and smell. So why is the interdental space so important? Gum disease starts between the teeth where your toothbrush or mouthwash cannot reach to clean. Interdental caries are the most difficult and expensive to restore. The most common areas for recurrent decay and failure. This is where bacterial invasion, inflammation enters your bloodstream and spreads all over your body, increasing your risk for heart attacks, strokes, diabetes, Alzheimer's, premature birth cancers, and erectile dysfunction, Ryan. Why should you care about the anatomy of the interdental space? It's keratinized, vulnerable to infection. You say caul is non-keratinized. What do you mean caul?
It's not. Caul refers to the interdental tissue between the contact points of adjacent teeth. And it's the main point about that is that it's non-keratinized as opposed to the facial and the lingual gingiva. And that's what makes it so vulnerable. So what happens is that bacteria accumulating in between the teeth end up penetrating through that caul and invading the bloodstream and causing inflammation, infection, and starting the breakdown. So gum disease essentially starts between the teeth more than anywhere else in the body, and because it has such restricted access where your toothbrush and your mouthwash can't get there to clean, the only thing that we've had for the past 200 years is dental floss to use to clean between the teeth. And lately there's other products which are actually very good, the wire brushes and the dental picks as an alternate for people who refuse to floss. But the thing is that there's a lot of drawbacks associated with both of them, and that's what motivated us to come up with the PerioTwist, because we were increasingly more and more frustrated trying to teach people how to clean between, and because of all the drawbacks, people really weren't doing it.
Well, you know, I never heard of the word caul before, C-O-L, so I'm Googled it now, and I found out why. It's Latin. It's French, caul, meaning neck, the lowest point of a ridge or saddle between two peaks, typically affording a pass from one side of a mountain range to another. Meteorology, a region of slightly... So basically, that's a French term you just threw at me.
It's actually a dental anatomy term.
I've never heard of it.
Well,
but my mother, it's Mother's Day, and I send her presents, even though I just sent her flowers and money and chocolates for Mother's Day, even though I'm sure she did drop me when I was a little kid. That's probably why I can't remember caul. I've probably heard of it before, but anyway, so explain the caul again.
So if you unscrew the healing cap of an implant per se, and you take a look at the collar of tissue all around, because that's a perfect example of what you're going to see. You're going to see a non-keratinized inner layer. When it's not an implant and just two adjacent teeth, then the gingiva that approximates the interproximals of the adjacent teeth, you have that little ridge, and that's called the caul. And the importance, the significance of it is that it isn't keratinized, and it forms the entry point of a lot of bacteria, and that's why a lot of the gum disease actually starts in between the teeth rather than on the facial and lingual surfaces.
But it's sad times for floss and all that, because all these Americans, I've been reading these newspaper articles for about the last 6 months in very prestigious newspapers like New York Times, that there's zero evidence that floss does anything. And I mean, I've heard this feedback from patients, friends, family. They say this is just all a little something that's in your head. There's no research to prove that floss does anything.
But nobody ever paid for such a research. I think it's more the lack of people paying for good research, because we all know that, of course, it works.
Anecdotally, Howard, you've been doing this for a long time, as have I. Even though the research has been flawed in the past, because most of the research was done by the supporting companies who sell floss, that it actually does work, and it works very effectively when used properly. The problem with floss, as we see it, is that, number one, most people hate the floss. How many times have you been in front of your patient and you're trying to convince them or motivate them to floss, and you come up with the same standard answers, which everybody says, you don't have to floss every tooth, only floss the ones you want to keep. Everybody laughs and chuckles, and then you show them, or the hygienist shows them how to floss, and you wrap around fingers, and then you place it in between the teeth, and then you wrap it around. It takes about 4 or 5 minutes to explain to somebody how to floss properly, and you can see after the first 20 seconds or so, we've lost them. And we've lost them because it's so impractical. And of those people who do floss, very few do it properly. So obviously, due to that frustration over many, many years of trying to teach and motivate our patients to floss, and we have to accept the fact that because it's so impractical and so inconvenient, you need 2 clean hands, you need somebody with manual dexterity. Seniors certainly can't do it. Kids can't do it properly. There actually, there's some dentists who got onto YouTube to try and explain to their patients how easy it is to floss. He gets up and he says how easy it is, and then he takes another 5 or 10 minutes to explain to people how to do it. There has to be a better way.
So you know why I asked you that question?
Why is that?
Well, a lot of my, all my homies listen to this. Most of them, probably 85% of them, have an hour commute to work, and podcast kills radio. They just don't want to listen to all the Trump, Hillary, all this politics. They hate it. So they're listening to stuff. So what I do is, so I don't want them taking notes while they're driving, so I always retweet my guest tweet. And you're, so on Twitter, you're at Dr. Allan Cooper, Dr. Cooper. And so I retweeted it, but your pinned tweet is Dr. Allan Coopersmith. I just published a dentist insights on the latest flossing technique. So if you're driving to work and you're wondering how do I get in contact with this guy, just go to my Twitter at Howard Ferran. It's my last tweet at Dr. Allan Cooper. But yeah, it's and even when you do see someone that says, "Oh yeah, I floss every day," they just snap it in between the contacts. They're just flossing the contacts. I always say if the floss ain't bending, you're just pretending, and they never bend the floss each way. They never do it right. But I know your gorgeous wife Nathalie Fiset is a hygienist. But I've always had one complaint with the hygienist, and that is when I was a little kid, The worst part of my childhood was for 1 year, my mom made me take piano lessons every Wednesday after school for a year. And the teacher said I couldn't carry a tune in a lunch pail and had zero talent. But when you go to piano lessons, they make you play the piano while they sit there and yell at you and tell you how stupid you are and all that stuff. And when you take a little kid to the hygienist, she does the whole cleaning. And I always thought that was so wrong. I always thought it should be a lesson because that kid, a lot of these kids have had their teeth cleaned every 6 months from age 1 or 2 to 10 years old, and they've still never flossed their teeth one time in their life. And I always thought it'd be better if you sat down with the kid and made sure he put on the right amount of toothpaste, that you showed him that the toothbrush had to have bristles that were straight and only a little pea-sized amount, and that you start on the upper right and go to the, and then have him floss. And it should just be a flossing lesson. I mean, if a hygienist was a personal trainer, you would just go there with a lawn chair and a beer and sit there in the gym and watch her work out. And I think it's a big anyway, I don't want to get on that. So what made you spend 12 years? And I bet you spent a lot of coin on this. I bet you could have taken a lot of trips to Paris, London, and Tokyo instead of making a flossing device. What's wrong with you? Why didn't you just go on a bunch of cruises?
We did both.
You did both.
We're all in. We're all in this one. We did spend a lot of money and a lot of time and a lot of heart and a lot of soul because we're passionate about it. And we're passionate about it because we really wanted to present a tool, an alternate to people that they could use as easy as they could with a toothpick. And it took us those 12 years to come up with this really simple device, that solves a very complex problem. And all those 12 years were dedicated to make it simpler and simpler and simpler and multifunctional at the same time.
And so my homies need to go to your website is PerioTwist, Perio, Perio, and then twist, TWISE, PerioTwist.com. If you go there, you can join their free newsletter. What are my homies going to find at PerioTwist.com?
Well, they're going to find a couple of things. There's a separate part for dentists and hygienists, and there's a separate part for the patient. For the patient, it's going to, what we were trying to do is we're trying to educate the patients to clean between their teeth because it's so important. And we're trying to educate them because it's so important and identify all the problems associated with not cleaning between your teeth. Not only from the point of view of decreasing the caries and periodontal disease and bad breath, because that's where all that bacteria ends up accumulating and festering. I don't know the last time people tried just a regular toothpick and they put the toothpick underneath their nostrils. It's a pretty foul odor, and that's all over their mouth. So we're trying to teach people how to, the importance of cleaning between. And at the same time, we're trying to motivate people to clean between, and then we're trying to facilitate by providing that tool to do it. Now, it's got a lot of really neat features for the dentist to use and the hygienist to use in their office as well. And, one of the things that it does, other than any other dental cleaner, interdental cleaner out there, is it will not only clean between the teeth, but it will also medicate between the teeth. And it will apply that medication in between the teeth and will leave that medication there. It won't withdraw the medication as the device is withdrawn, as opposed to wire brushes or anything else. And that has a lot of relevance to the, in the dental office, because we use it almost routinely for anybody who has very sensitive gums prior to any kind of scaling and root planing. We just dip it into some topical anesthetic, place it in between the teeth. That's where that non-keratinized caul comes in too, because it's in between the teeth as opposed to the keratinized facial and lingual gingiva. That topical anesthetic penetrates right in, gives a very profound topical anesthesia, and people really enjoy that.
What is the medication?
It's any topical that you use before an injection. You can use the same thing. It's usually a benzocaine whatever. It could be liquid, it could be a gel. Both will adhere to the PerioTwist by a process of capillarity because of the way that the spiral is designed. So you can then apply that between the teeth and it'll stay there.
Do you have a YouTube video that shows this being used?
Not yet. It's on the way. You know, Howard, I think we're very proud to tell you that we are using your podcast as the introductory. This is our launch to the dental profession. We we had a tremendously successful Kickstarter campaign a few months ago, and where over 2,800 people purchased over $118,000 worth of PerioTwists. And we're just launching it now to the dentists and to the hygienists.
How much did the Kickstarter campaign sell?
$118,000.
So did you get all your money back?
Oh no.
What was the total coin invested in this dream?
It's about $350,000 so far.
All right. You're over a third of the way there.
I'm all in. We're all in on this one.
And what is a Kickstarter campaign?
A Kickstarter is a crowdfunding website, which a lot of the latest and greatest of gadgets are introduced. And what they do is they pre-sell the products. We have a video, and it tells you all about it. And for people who want to fund or support you, they can make contributions, and in return they get, in our case, they got PerioTwists, different quantities. There was a
so you didn't give them equity or shares, you gave them product.
Exactly, we give them product.
How long is that video?
The video is I think about 4 minutes, and we have 2 other videos which is on our website right now. One of which is 1 minute basically video, and we have a more detailed 5-minute video which we're going to be putting up as well.
Well, why don't you email those videos to howard@dentaltown.com. And are you Ryan at dentaltown.com, or Ryan? You are? Why don't you email them to howard@dentaltown.com and ryan@dentaltown.com, and we'll attach these videos at the end of the podcast. So if they're on iTunes, they can listen to them, and if they're on Facebook or YouTube or whatever, they can watch them.
That would be great. Thank you.
Yeah, that'd be really cool. So, you know, another thing about the mind of the patient. I mean, how many times have you walked out of the gym and you watch this beautiful lady who's on the Stairmaster for an hour, and then she walks out to the car and lights up a cigarette? So many people diet and exercise to look sexy, not for health and longevity. And I think I've connected with more boys telling them, especially in the high school range, I'll say, you don't floss, do you? And they go, no. And I say, well, let me tell you something. In high school, you walk up to Sally Sue and you say, hi, Sally, and she smells that breath. I can smell your breath through my mask. She's going to smell it one time, and she's never going to think of you again. If you ever want to be a date, I mean, I don't know, maybe you want to grow up and be a Catholic priest. I don't know. But if you ever want to date a girl and get married, you better change your breath. And the only way you're going to change your breath is brush and floss. So don't brush and floss for me so that you don't come in here and need cavities and root canals. Brush your floss so that someday you can have a girlfriend. And I swear their eyes are the size of silver dollars. I think that resonates more with a lot of people. And like, they come in and you tell them they have gum disease and 6 cavities. And then they say, oh, well, I'm interested in bleaching my teeth. And you're like, oh, my God, you know. And they say, well, can I just get them bleached? Then I say, well, no, I can't bleach your teeth with a bunch of open cavities and gum disease. So I need to clean your teeth. Plus, I can't even get the bleach on your teeth because they're covered with plaque and tartar and calculus. In fact, the best thing we could do to whiten your teeth is first clean them, get all the plaque and tartar off, fix all the cavities. Then we'll bleach the bejesus out of them. But what motivated them to fix their cavities and gum disease was because they wanted whiter teeth, because they got a job interview, a date, you know, something coming up down the line.
I couldn't agree with you more.
I would assume there's a lot of stained teeth in Quebec because I've lectured in Montreal several times, and it seems like there's a lot of red wine going on in Quebec.
There's a lot of red wine going on, then some.
So
And then
do you personally drink white wines to have those whiter, brighter teeth?
we drink all wine. We're non. But interesting to your point about fresh breath. One of the things that we were doing over those 12 years is coming up with a type of a solution for that as well, other than just cleaning the bacteria between your teeth. And what we did was we have a proprietary 100% natural antibacterial, which is actually an essential oil with a mint taste and a mint flavor. And this accomplishes two things. The first thing it accomplishes is that the PerioTwist actually self-cleanses between uses, because this essential oil leaches out of the plastic, and as it's being used over the lifetime of the product. And the other thing it does is it leaves you with a nice, clean, minty taste in your mouth and smell as well. So that's an additional benefit of the PerioTwist.
And what is the lifetime length of a PerioTwist? How long does it last?
It depends on the usage, but under normal usage, it should last. One PerioTwist should last approximately a week, even up to 2 weeks. And it's made out of two types of plastics, both which are, of course, FDA approved, and they're medical grade plastics as opposed to food grade. And it's set up, we're actually manufacturing it close by in Quebec, so we can keep an eye on the manufacturing. It's done in a clean room with all the bells and whistles, because after all, it is something that's going, in your mouth. And
well, you guys are Canadian, so why would you care if it's FDA approved?
Because interestingly enough, the Kickstarter campaign had 90% of our purchases from the United States, and the FDA approved. We would like to bring this PerioTwist worldwide. It does have a worldwide patent pending, and it's actually all the instructions is in both in French, English, and Spanish. So we want to have a very broad scope as far as being able to provide it to the rest of the world.
And FDA has a meaning for Canadian also.
Yeah, FDA is recognized everywhere.
Yeah. No matter how good the PerioTwist is, you'll still never have the #1 product that comes out of Quebec. Maple syrup. You guys make like 90% of the world's maple syrup, and I swear to God, you guys make the best maple syrup in the world. So are you making this because you feel guilty that all these Americans have cavities from maple syrup oozing in between all of our teeth, and you tried to invent an anti-Quebec maple syrup device to clean it back out?
At least now we have a chance.
So my homies, if they go to PerioTwist.com, they can order 100 of these for $139. So they're $1.39 each. But I really was really excited. Well, I want to continue reading your deal, because there was one of the things I liked where you were saying about was the marketing aspect. Talk about the marketing aspect, because do you sell them attached to a dentist business card, or what is your marketing program? Because that's pretty cool. Instead of handing someone your business card, that'd be a very different behavior if you handed them a business card with a PerioTwist on it, and they went home and were playing with this, and then that would start a conversation in the family. What are you doing? Well, I ran into this dentist at the mall. So do you do that?
Yeah, right now we're designing. It's almost finished, but it's our intention for anybody who orders the clinic pack or the professional pack. It's 100 or 200. Those are the bulk packs that we're going to be selling to the dentists for use within the office. And after they use it in the office, they can just take the cap, place it and cover the PerioTwist, and then give it to the patient. But we figured it would be really neat because we're giving toothbrushes and we're giving floss and everything else, but it would be really neat if the dentist had an incentive, some value-added benefit to be giving the patient this this PerioTwist, and we devised this little wallet, and it's a little paper wallet. It's basically a little fold, and there's a place where they can put the PerioTwist and the professional and his business card. And inside it says, thank you for the referrals of your friends and family, or the confidence for the referrals of your friends and family. And there's another part that says, just because we care about you. And they give them the PerioTwist, the dentist card. So, it's a nice subliminal way of asking the patients, number one, for referrals. And if you like what I'm doing, spread it around.
Well, do you have one in front of you?
No, but I will send you the artwork for it, so you'll see it. Basically, it looks like a little, think of it as a little bit bigger than a business card, whereby you can just open it up, and there's two sides. There's instructions, and on the inside, you can put the business card and the PerioTwist into it.
And you said if my homies ordered it, you're going to give them a discount if they enter promo code Dentaltown17. They get 10% off their order.
Correct, but it's not Dentaltown 17. It's just Dentaltown.
Oh, okay. Just
so
Dentaltown.
Just Dentaltown. Whoever is listening to this podcast, and if they write in Dentaltown under the promo code, they'll get an immediate 10% reduction.
See, I wouldn't have done a 10% discount. I would have given them a bottle of maple syrup, but that's just me. That's just me.
Hopefully there won't be enough maple syrup to give all the people who are going to be calling in.
I like on your website where you say, that is amazing, Quebec, though. I mean, I've seen those factories where, and back in the day, you just have a little pipe in the tree and hang a barrel on it. Now
Right.
it's like and you'd hand milk cows. Now there's like tubes with suction tubes and all going. I mean, it is a mass production, high tech. I mean, that is crazy to look at how they do that. But I like on your website how you say advice for young dentists and health students. You are the future. It is time to stop the recurring cycle of drill, fill, and bill. It is up to you to prioritize prevention rather than treatment. Oral hygiene should be the most lucrative part of your dental practice, require the least amount of stress for both of you and your patients, and everybody wins. You said you loved my interview with Mickey McManus of the RDH hygienist of the Productive Academy Group, who said that the role of the dentist is to get the patient well, then to transfer the patient back to the hygienist for a maintenance program designed just for them. The only time that the dentist should see the patient is for an examination in the hygiene room. But I want to tell you the truth. Young dentists, when they read that, they're going to say, What do you lost your mind? I mean, a root canal is where the money is, not the hygiene department. The money is placing an implant, not the hygiene department. Why should a young dentist believe that there's money in the hygiene department as opposed to root canals and crowns and implants?
Well, that's a great question. And ultimately, it's the big companies that are dictating to us as professionals where the emphasis should be. And right now, they're making a lot of money selling us CEREC machines and selling us digital scanners and all sorts of stuff, putting everybody into hock up to the wazoo. And we're forgetting the very basics. All these, I listened to quite a few of your podcasts, one of whom was with this terrific guy who does websites for dentists, and he was talking about search engine optimization and all the bells and whistles in order to try and get new patients, when the best way to get a patient is to have a happy patient in your chair. And there's nothing that's going to show the patient that they're more progressive and more preventatively oriented than people who deal with prevention rather than treatment. And all those happy people will end up referring their friends and family because they will see that this young dentist really is progressive in his thought rather than the old guys who are just drilling and filling. They're frustrated. I believe patients are very frustrated today, especially the ones who have such, poor oral hygiene. The cause of the problem is never really addressed properly. So whenever whenever they get the plaque accumulation, then they get the cavity, then they get more plaque, then they get a bigger cavity, and then they end up needing the endo. After the endo, they end up needing, the crown, and then the tooth fractures, and then they end up needing an implant. And the same problem, the initial, bacterial infiltration that caused the mucositis, and then the periimplantitis, and then they're back to the beginning again. And in a sense, there's so much out there already. They don't have to worry about not having any work to do. They're already treating all the failures that we've had, all these years. So there's lots and lots of work. If they start the prevention right now, not only will they be, making a name for themselves in the community, but they will also have all that, restorative work to redo that's already been done. So, maybe in 30 years or 40 years, there may not be, as much restorative dental work. And when a person buys or sells a practice, the first thing that they look at is the oral hygiene department. I would much rather go in and check a patient and speak to a patient and motivate them than, to do, MOD, for an hour. And if I can get 2 or 3 people going through the hygiene section, I'll be making a lot more money. I'll have a lot less stress, and I'll feel, rewarded for it because I'm really doing a good thing. And
they could always crack their teeth. There's other ways to breaking teeth than by not prevention. There's other things that can happen.
Well, I think what you said is amazing because I love the quote. The purpose of a business is to create a customer who creates new customers. And, when I'm kind of a brutal when I talk to my patients, for 30 years, when a human feels like they're a victim, they feel like it's someone else's fault. If you're mugged, you're a victim. You were walking to the store and someone mugged you, you're a victim. They go, and when you tell them they need a root canal, they go in this victim mentality. And someone else should pay for it. Obama should pay for it. The boss, the employer, someone, because I'm a victim. And every time they ask me, they say, well, how much is a root canal? I say, well, I don't know. I've never had one. I brush and floss every morning. I brush and floss every night. And Jan has been my only dental assistant for, I graduated from dental school 30 years ago yesterday on May 11. And I said, Jan and I only see the hygienist. And we do what the hygienist says. And if you do what the hygienist says, you're never going to see me. And the minute you stop doing what the hygienist says, you're going to see me. And you're always, when your car falls apart, you just fix it. When your roof starts leaking, you fix it. But when something goes wrong with your teeth, you think the insurance should pay for it. I said, what if you didn't want to have any kids anymore? And the insurance would only pay for a total castration and you wanted a vasectomy. You're going to get your balls cut off because, you're a victim? I mean, if you don't want to have kids, pay your own money for a vasectomy. And if the hygienist says she wants to see you every 3 months and the insurance company says we'll only pay for it every 6 months, then lose all your teeth. I don't really care because in the United States, at age 64, 10% have 0 teeth, times 2 missing half. And at 74, 20% of Americans have 0 teeth, times 2 missing half. So go to the hygienist, do what she says, pay for it out of your purse and wallet, or you'll be back.
Yep.
And clean between your teeth.
And clean between your teeth. And I read that book, the Beating the Heart Attack Gene. It was a very interesting book. And there's multiple causes for heart disease. I mean, smoking, diabetes, obesity. But one of the deals was about, 5 gram-negative anaerobic bacteria. And they're only found underneath your gums and in between your teeth. And a lot of heart doctors... And there's a lot of. Do you think it's good research that gum disease is increasing heart disease, or not so much? Do you think it's anecdotal like flossing, or do you think there's actually good research?
That's a great question. I think the evidence is overwhelming as to the association between gum disease and heart disease and other problems too. I think that is without question. Now, what exactly the cause and effect is, I can't tell you. I don't think that's already been established definitively, but there's enough evidence to show that we as gatekeepers to the total body health of a person, and I really believe that we are those gatekeepers, if we can motivate people and show them a way and provide them a device that can clean between their teeth where almost all the problems in the mouth end up originating, then I think that we can do people a great service. And I think that that there's no doubt that a lot of people who do have heart disease do have gum disease, and whether those are double-blind studies or not, or to what extent they are, I really can't tell you for sure, but I do know that there is enough evidence to show that.
I know the gold mine for epidemiologists. The thing they love the most is identical twins raised apart since birth. I mean, that's the rarest data on earth. And so a lot of people that want these double-blind studies, I mean, how are you going to do a double-blind study on flossing? What are you going to get? Two identical twins? They have the same diet. Everything's the same. One floss, one doesn't. But I also think there's a lot of, like in the, there's good evidence showing that people who floss every day live 6.5 years longer. But then again, you got to think to yourself, a person who flosses 6.5, a person who flosses every day is probably more likely to exercise and eat right and go to yoga, where a person who's never flossed in their life is probably smoking right now, having a beer, drinking a bottle of maple syrup, and and the thing that motivates me the most about your product is the hygiene department in general. The dentist is obsessed in this failed ideology of advertising, and all they want is these new patients. And they'll go into a town of 10,000, and they'll spend 5% of collection on advertising wanting new patients. And you go up to that guy after he's practiced for 50 years and say, "Hey, buddy, what do you need right now?" "I need new patients." It's like, dude, you've gone through everybody in the county. Whereas big Fortune 500 are into loyalty programs. And when you fly American Airlines or go to Walmart or Costco, everybody's used them once. So they don't want new customers. They want loyal ones to stay with credit cards and discounts and all these things. And if with humans, they're either in or out. Like take bowling. They either haven't bowled for 10 years or they're totally in and own their own bowling ball. Boating. They haven't gone boating in 10 years, or they either own their boat and go boating regularly. Same thing with dentistry. You know, the average dentist has got 5,000 charts, 4,000 never came back because they weren't in. They weren't motivated. Exactly. And if you get them into a hygiene department, you don't have a hygienist that's talking down and scolding them and making them feel bad, but being that coach, that Vince Lombardi, that motivator to make them want to go all in to take care of their teeth. And they need toys and they need electric toothbrush. That was another question I want to ask you. Are you a big fan of manual brush or electric? Because sometimes I think when you motivate them to go buy an $80 toothbrush, maybe that's their new bowling ball. Maybe that's their boat. Maybe that's the new gadget that makes them get back in. Because if they're in, they'll see you every 6 months and do everything you say. And if they're out, they're only going to show up when they got a toothache or something broke. So answer the toothbrush question. Because what do you think about what do you guys think about toothbrushes?
Let me ask you a question. If you were to saw a 2x4 and you use a hand saw and you're going back and forth, or you take a power saw and you just go right through it, which one would you rather use?
Well, I'm an expert in karate. I bought a black belt. I bought a black belt on eBay for $9. So wow. I assume, I've never done it, but I assume I could just karate chop it in half since I bought that black belt. But you're right. That's a good, you know what? Kudos to you. I've been a dentist 30 years. I've never heard that analogy. I swear to God, I know it. I love it when I see it. And from now on, when someone says electric toothbrush or brush, I'll say, well, if you got to saw a board in half, do you want to do it with a manual saw or do you want a power or would you say a chainsaw, electric saw?
Just a power saw will do. But you know, Howard,
great analogy. That was worth the whole podcast.
Wow. Well, hang on, because we might be coming back with our next invention, but we can't get into that right now. Howard, let me ask you a question. We are so firmly committed that to oral hygiene that we actually encourage our patients to get a power toothbrush, even if it's a battery-operated one or an electric one. We see a remarkable improvement in oral hygiene because most people tend to brush their teeth probably for about 25 seconds or so. If that, you know. So when we ask the patient who's sitting in the chair, we say, do you have an electric toothbrush? So they say, oh yes, we have an electric toothbrush. And we take a look in their mouth, and there's quite a bit of plaque. And then the next question I say is, do you use it? Oh no, the battery's broke, or this or that. So we really encourage our patients to use the electric toothbrush and to go out and buy one. And we find that the oral hygiene is really significantly improved because it's just so much more efficient. They'll only brush for 25 seconds anyway, but at least that you know, whether it's oscillating or whether it's sonic, both cases the bristles are just so much more efficient in cleaning.
There's no way a person could beat an electric toothbrush manually with the speed and the vibration that there is to compare.
And you know why I like the Sonic electric toothbrush the best? Because my favorite restaurant is Sonic Drive-In. And so I'm already... Do they have those up in Canada?
No.
Ah, lucky you. That's why you probably both aren't on insulin right now. I want you... Allan, how long have you been you've been 41 years in practice?
Correct.
And how about your lovely wife? She's going to say only 4, right?
22.
22?
Yes.
So you guys, you got 41 years experience, and the hygienist has 22. These young kids are really throwing periodontists out the window, and they really believe, well, you know, this tooth's got gum disease, it's got a furcation involvement, you know, I'm just going to, you know, it'd be a lot better. We'll cure this once for all. We're just going to extract and place an implant. Because everybody, you know, you talked earlier about it, you know, the noise of the media, which I'm not a part of. That's why I call mine Dentistry Uncensored, because I call bullshit when I see it. But everybody's trying to sell them CAD cams and all these digital impression, all this expensive stuff. And I'm sitting there, and they're telling them that implants have like a 4% success rate or a 3.5% success rate or a 2% success rate. Dude, that is horseshit. When you look at implants and you're out in the field, 20% of them have periimplantitis, big time, and this is affecting the rest of their organs. And Grandpa comes in, he's got 9mm pockets on a bleeding implant, but he has no pain, and he can still eat a cheeseburger, and so he thinks he's good. So tell these young kids who believe, I want you to, you've seen in 40 years, how much gum disease would you have to have around your molars before you yanked it and placed a dental implant? And how much periimplantitis are you seeing up in Quebec around these implants that have been in the mouth 10 years?
We're starting to see a lot of failures, a lot more failures than people are letting on. And the reason is pretty clear and evident to us. You know, the cause of the problem, the thing that caused the whole cycle leading up to the implant has not been addressed.
Right.
And if you look at the morphology of the implant as relating to the adjacent teeth, I mean, you have an 8mm implant, and then the restorative crown extends way out. So you have 2 huge embrasures on either side. And floss cannot, even if you're using it properly, cannot break through the contact and go all the way deep underneath. You have to have another interdental aid. And unless you get rid of that bacteria that's causing the breakdown in the first place, then it will lead to mucositis, and then that will lead to periimplantitis. And a lot of failures are showing up now that of all the people who've been placing in those implants, you know, by the truckload, and now there's a lot of failures coming home to roost.
Yeah, but Americans don't want to change their behavior. They just want to take a pill. Is there a pill for this periimplantitis?
There is. It's a toothpick. It's a simple, if you can use a toothpick, you know, as we get older, seniors have a big problem because their gums recede. The triangular formation of the root as the gums recede create bigger and bigger spaces. And combine that with the fact that their mouths are dry because of a lot of medications that they're now taking. They keep getting food caught in between their teeth, and you hear them kind of going all the time. And if they can use it, I can't imagine a lot of seniors using dental floss, but they can use toothpicks. And if they use the PerioTwist, the handle is actually specifically designed as an easy grip device for seniors in mind. So, you know, the seniors can use a toothpick. It's simple. That's what the 12 years was all about, Howard. We wanted to make it as simple and multifunctional as possible. And I believe that we've succeeded in that. And any person in our office who gets an implant or gets a bridge or has a splint, they all get a PerioTwist. They get it for free because I don't want my work to fail. And I don't care how great the dentist is, unless you get the bacteria away from the most beautiful dental work in the world, it's going to fail again. And it tends to fail interproximally before anywhere else.
And you know, the doctors are part of this. You know, they never change behavior. Like, what scares me the most about Clear Choice is do they have Clear Choice up in Montreal?
No.
Okay, well, it's an implant center. It's a national chain.
They have implant centers all on four and that kind of things.
Yeah, so all on four is invented in Portugal by Dr. Pelo Malo, but the Clear Choice started doing it. And typical American solution: you come in there, all this gum disease, they rip everything out, put everything back in, and you leave at $25,000 an arch with full set of beautiful teeth, and they do a great job. And they're doing about 18,000 arches a year. But what's the chance that person changed their behavior? I mean, if I just walk, it's kind of like a bypass. I love this study I saw one time where identical twins, one had insurance and had the bypass. The other one didn't have insurance, but changed their behavior and quit smoking, lost weight, and started exercising. Guess who lived 3.5 years longer? The person with the $100,000 bypass or the person who changed their behavior? And so we're still going from the medicine man. So we're a 2 million year old species where 100 billion of them have come and died. And for 2 million years, when you got sick, you went to the medicine man and they either cut something off or made a lotion or potion. And here it is, 2017. And when every American gets sick, they want to go to the doctor and they want a surgery or a lotion or potion or pharmaceutical pill. And you have to kill the medicine man model, and you need to go to the behavioral health model, which is the medicine man has never cured you for 2 million years. You have to change your behavior. And again with this with the hygiene department, I mean, again, the average dentist, 4 out of 5 of their charts at any size of their practice is currently not scheduled for a cleaning, and that is a big lucrative part of your practice loyalty program. And these young doctors who come out of school and listen to all these magazines and take all these ads from all these implant companies, just rip out the gum disease and put in an implant. You didn't change your behavior. And they do it the same with children. When a child has anxiety, they don't treat the anxiety. They sit there and try to knock them out, put them to sleep, drag them to the hospital, instead of going really slow, talking to a 5-year-old, explaining the instruments, building trust, short visits, coming back. They're Americans. They don't want to do that. They want to come in, knock out my kid, drill out all his teeth, and then a year later, what's changed? Nothing. So we need to change behavior. Agree or disagree?
Agree.
Wholeheartedly. You know, that's why we got on this journey to begin with. The hardest thing is to change behavior. It was even harder to sell them to change the behavior if you had to teach them how to floss or use the floss, which really is a pretty impractical thing. It was invented 200 years ago. It was time to do something new, and we figured, you know, all dentists are inventors by nature. It's in our nature. We do that all day long. Every procedure we do, we invent something different because no two procedures are the same. And between the combination of Nathalie and my experience, we figured that if we didn't invent something great, you know, who's going to? And it's by providing them with this easy to use tool, finally, that at least there's a chance to change their behavior, because all they have to do is use it like a toothpick. It works both ways. You can twist it, it goes in and out. Any way you place it between the teeth, it's going to clean your teeth.
You know, Thomas Edison, one of the world's greatest inventors of all time, said the way to be a great inventor is you just need to have curiosity and a pile of junk. And the dentists who are the most successful, they have that natural curiosity. And I tag that behavior with their hours of CE. I mean, the dentists who just, in my 30 years experience, I've seen a lot of dentists come and go. The ones who took like 100 hours of CE a year, their whole career, man, they were naturally curious. They just couldn't be satiated. And they were humble, because maybe the chairman of your department, who was 800 years old, maybe he'd said something wrong. And you got to hustle. And man, if you're naturally curious, humble, and hustle, you're going to crush it in dentistry. And that's another reason I'm really proud of these podcasts, because they might be in a small town and they only have like a study club that has like one meeting a month for an hour. And now we're giving them an hour on the way to work. And the only reason this show is great, the only reason it's great, is because I'm able to get great guests on like you. And if those kids, if they just keep their curiosity going, and if they stay humble, even though you're a doctor, you don't know anything, and you don't know anything, because I got to ask you this: 100 years from now, what percent of everything we believe in dentistry you think is going to look silly?
I'd say
what
quite
percent? What percent would you say?
Percentage? I'd say probably 80%, because we're focused on treatment rather than prevention. And there won't be a need for root canal work. There won't be a need for implants. There won't be a need for whatever, because it'll be probably genetically controlled to begin with. And the treatment will have some sort of genetic component to it. And it will be as easy as taking a pill or doing something, increasing a person's resistance. I don't think in 10 years dentists will be practicing dentistry the way we are today.
Right. Will you get me that GV Black book? I need to do that project. I'm reading that online. One of the greatest Christmas presents I ever bought for myself was the first 3 books written by GV Black. And they were like 1898 and I think 1898, 1901, and 1903. And he was like, I know you guys, I know your lovely wife is French, and the first dentist was Pierre Fichard in French in the 1800s in Paris. And America's first legend, like Pierre Fichard, was G.V. Black. So I got his 3 books. They cost like $8,000. I mean, these are museum quality books. They're even autographed and signed by him. So wow. I was so excited to read the smartest guy in dentistry from 1 century ago, and I was just like, oh my God, this is crazy. I mean, they were trephinating into jaws to let evil spirits out. And then when they showed you what the evil spirits look like, they all look like the king's court jesters, these little guys with hats on and elf shoes and bells. And so I imagine it's going to be the same 100 years from now. A lot of this stuff is going to look pretty crazy. And it's going to be a lot more behavioral changes. Like I always talk about orthodontics. America, if you listen to the archaeologists and you look at these 2 million-year-old sapiens, as soon as you go back like 300 years, there's almost 0 malocclusions. And now everyone has a malocclusion because for 2 million years, the forces on your face, stress equals force over area. When you're nursing for years, that's putting pressure on your maxilla, spreading your palate. Your mom handed you a bone with cartilage on it or some vegetable that wasn't cooked and boiled. And now, as soon as the baby has any difficulty nursing, they switch to a sippy cup and a bottle. And then they feed it applesauce bull crap out of a jar. This kid's never had any force on his face. So then they all need orthodontics. And there's I don't know of a single orthodontist in America who holds, like a evening class once a month for every woman that's pregnant to go over there that if you nurse your kid for a year or 2 and you feed it stuff that's hard to eat and he has to chew and use force and all this stuff, that'll be the natural forces that spread his palate and develop his teeth. And we won't have to pull teeth and we won't have to do ortho. So I think these millennials, I mean, when I was born in 62 and I was 72, Mom bought me my set of encyclopedias that were printed in 52.
Right.
Now these kids on their smartphone got Wikipedia with 52 million pages of updated information. I think these millennials are going to be the first generation to walk away from the medicine man who wants to cut something off and give you a lotion, potion, prescription pill. And they're going to be in the dental office saying, I don't want to see Dr. Drill, Fill, and Bill. I want to see the hygienist. How can I prevent decay? How can I prevent ortho? You know, they're going to go, but I don't like the term all natural because they say, I want to do it naturally. And I'm like, dude, a hurricane is natural. A tornado is natural. A black hole sucking in the entire galaxy is natural. I don't like the word natural, but I think they're going to want to go from more surgical to prevention.
And one thing is for sure, they will all want to have good breath. That will never change.
Yeah.
Yeah, and in Quebec we kiss on both cheeks, so you know you get a whiff on both sides.
And we French kiss.
And the French kiss. And even better, the only thing better than the French kiss, the French fry at McDonald's.
Yeah.
That's another story. They bleach their potatoes, but
go ahead.
You'll never see a little brown spot on a McDonald's French fry.
Because they throw them away if they do, or
no, they treat it with some sort of.
Apparently, when they go in the field, they cannot go back in the field for 5 days after putting all the chemicals. And then when they collect the potatoes, they store them for 6 weeks before someone could even think of eating them.
But I'm sure they figured something out there. But
because they're all the same all around the world. If you go to Russia to McDonald's, you're going to get that same nice potatoes.
Yeah, I like the billionaire. The billionaire who did that was J.R. Simplot in Idaho, the Idaho potato. And what he realized is that when they would do the potatoes and they'd ship them out to McDonald's and all these places all around, the shipping time, the changes of humidity, the packaging, the bruising, and then people would cut they'd skin the potato, they'd make the French fry, they'd do it at the 350 oil, and the majority were coming out soggy. But where McDonald's was started in Southern California for the first 10 locations, they were nice and crispy and salty, and everybody loved them. And then these franchisees would go buy a franchise in some state like Kansas with humidity and say, what's wrong? Mine are soggy. Then they go out to Southern Cal, and they were all crunchy. So they realized it was the humidity, the packing, the shipping, all this stuff. So this guy, J.R. Simplot, he said, this is what we're going to do. We're going to get the potato. We're going to skin it and cut it in French fries, but we're going to just we're going to start the frying for just 10 seconds, and then we're going to flash freeze them and the frozen French fry. And then you could ship that frozen French fry all around the world with a shelf time of a year, and it would come out crispy, just like the original McDonald's in the desert in San Bernardino. And see, my dad had 9 Sonic drive-ins. That's how I cut my teeth in business. So when I was little, my dad was opening up Sonic drive-ins. And so in my dad's world, Ray Kroc was just the man. I mean, he would be like our Pierre Fichard. I mean, you know, I even got to see that guy speak. He was an amazing man. He really was. As far as a businessman and a speaker, I know that some of these guys like him and Jobs aren't so good on the family side, but God dang, he was an amazing entrepreneur, and he was that natural curiosity. So when he had soggy French fries, he didn't throw in the towel. He stayed humble. He asked questions, and he kept going back up to Idaho. He was a hustler, and finally, this J.R. Simplot guy figured it out, and he became a billionaire. And my favorite J.R. Simplot quote was, they said to him one time, they said, "J.R., you're in Idaho. You're a billionaire. You ever thought about running for a governor or a senator?" He said, "Why? I own them all." And that, my friend, is the reality of American politics. They're all owned, bought, and paid for. It must be very embarrassing living up in Canada, looking down at your neighbors. I always think of Canadians, these really refined people living in the upper loft of an apartment, and they're looking down, and they're all down there smoking and drinking, and no one's reading. And I mean, it must be very embarrassing when you look down at the United States.
Listen, you know, we're very proud to be American neighbors. There's good and bad in everything, and you know, I'm sure the North American treaty notwithstanding, I'm sure that there's going to be some sort of rapprochement, we say in French, where we get the two countries back to loving one another like we have for many, many years. We share the longest common border of any two nations in the world.
Yeah, but my take is, I think the most successful people in media and social media and all that stay focused on one subject. Like if I want to watch a chef, I just want to know his recipes. I don't care about his politics or his beliefs. So I started to stay away from religion, sex, politics, violence. Those are the four no-nos. But what I always tell my homies, especially those young kids on politics, I see politics exactly like sports. When how many of my staff complain about their husband because all day Saturday he watches, 5 college football games. Then all day Sunday he watches, 3 NFL games. And he never gets anything done. And I see so many of these young dentists on social media, and they're spending all this time talking about politics. It's like, dude, you could have spent all that time and set up your hygiene department. You could have used all that time and learned how to do root canals. And if I spent 40 days and 40 nights obsessing about North Korea or Putin in the Ukraine or whatever, what would that? I couldn't buy myself a cup of coffee. In fact, I'd be able to buy less coffee because I have patients not coming back. So you're actually losing money when you watch politics and sports. And the reason I watch sports is because politics makes me feel bad. And when I watch the Arizona Cardinals, it actually makes me feel good. So if you're watching something that's making you cuss and scream with the TV, turn the damn thing off. I got to tell you my most embarrassing Canadian story. When I tell you this story, you're probably not going to believe it, or you're going to think I'm dumber than a rock. So I got out of school in '87. It was some dental society in Toronto that brought me up in like 1990. And this guy introduces me. He said, "This guy is the Wayne Gretzky of dentistry."
Wow.
And I said, "Who is Wayne Gretzky?"
Right.
And they thought I was kidding. And I said, "No, really, who is?" I mean, I grew up in Kansas. I never saw a hockey game or lacrosse in the 60s and 70s. And now in Phoenix, we actually bought one of your Canadian hockey teams.
That's right.
And so that night, it was lucky. So that night, the Toronto team was playing a New York team. And this guy said, have you never really seen hockey? And I said, never. And he goes, okay, well, I got 4 amazing tickets. So he took me to a hockey game. That is the fastest, funnest game in the world. And I love the Phoenix Coyotes. I mean, football, you play for like 30 seconds and you stand around for a couple minutes. Then it's 30 seconds, you wait a minute or two.
Yep.
30 seconds. Hockey's just crazy.
Yeah, it's on the fly. Just keeps going until a penalty or an offside.
Yeah, it is amazing. Well, hey, dude, that was the fastest hour of my life. We're at an hour. We're 3 minutes in overtime. So basically, you're going to send me those videos.
Yeah.
And my homies are going to go to PerioTwist.com, and they're going to donate $139 to get 100 of them. And hopefully they're going to fall in love with them. And you're going to, when they buy them, if they use the Dentaltown code, they're going to get a 10% off. But more importantly, I want a marketing side to this. Hopefully you really explain to them this deal, that billfold wallet PerioTwist business card, because again, giving someone a business card, they'll probably just throw it away or put it in their pocket and the washing machine will eat it. But if you give a monkey a toy and he starts playing with it, you might just change your behavior and have a customer for life. And that just might be, I think this could be a big part of getting dentists to switch from advertising to loyalty. And loyalty is changing your behavior. And I don't want implants and crowns and root canals. I love doing it. But I'd rather see your beautiful wife than Allan for a root canal and an extraction and a root canal any day.
That's a success. That's the secret of our success. They want to see her. They don't want to see me.
Yeah. But, hey, Allan Coopersmith, Nathalie Fiset, go to PerioTwist.com. And thank you so much for coming on my show.
Howard,
Thank you.
it was a great privilege and a pleasure, and we thank you very much. And I'll send you off those videos this afternoon.
All right. Have a rocking hot day.
Thank you so
And
much.
eat some fresh maple syrup for me.
You got it. Tonight.
A healthy mouth is a healthy body. By taking care of your mouth, you're going to decrease the amount of bacteria You're going to prevent cavities, gum disease, bad breath, stroke, heart disease, and other serious health issues.
Husband and wife team Dr. Allan Coopersmith and Nathalie Fiset recognized the many problems associated with current options for cleaning between the teeth and developed a revolutionary new tool in oral health care, the PerioTwist.
We are very proud to say that our PerioTwist is composed of an FDA-approved medical-grade plastic, which is BPA-free and incorporates 100% natural antibacterial, making it self-cleaning in between uses.
Say hello to the new wave of oral health care. To learn more about the future of oral care, please visit us online at PerioTwist.com. It's something we do every day. We wake up and brush our teeth, usually without thinking twice about it. Many of us don't realize that brushing our teeth does more than just clean our mouth and give us a great-looking smile. It's an important part of maintaining our overall health.
It's very important to take care of our mouth, so this way we could decrease the amount of bacteria and we can have better gums, and this way being healthier, because we know there's a link with gum inflammation and some disease, so it's better for our overall health.
Research has shown that the billions of bacteria living in our mouth, especially the bacteria hiding between the teeth, can inadvertently affect other health systems in our body.
It's important to understand that gum disease starts between the teeth, where your toothbrush and your mouthwash cannot reach to clean. And the bacteria settles on the teeth and creates cavities, and it settles on the gums to create swelling and pain, inflammation, and bleeding. That bacteria then is able to penetrate the gum tissue and go into the bloodstream and travel and circulate all over your body that can create serious illnesses in the future.
While flossing or other methods of cleaning between our teeth have been a practice encouraged by dentists for years, if they are done improperly, it can lead to bleeding of the gums, which has many people opting out of the process completely.
People stepped out of flossing because it's very hard to use it properly and it takes time, and then if you use some brushes with metal, they're afraid to break their teeth with it, it's scratched, doesn't feel good. And then if they take a small one for the front, it's too small for the back, so they just give up and they feel they cannot do a good job anyway.
It's essential for people to clean in between their teeth and use the interdental cleaners, because that's where the bacteria is hiding. If you do so, you can virtually eliminate and prevent a lot of tooth decay and gum disease, and significantly reduce bad breath, as well as all the problems inherent with infections going through your entire body because of the bacteria that's there.
Dental surgeon Dr. Allan Coopersmith and registered dental hygienist Nathalie Fiset recognized this issue with the most important area of the mouth and worked to find a solution by creating a new tool to combat bacteria and aid in dental treatment.
It's very upsetting to us to perform dental treatment on patients knowing that all that could be prevented. Most people just refuse to floss or clean between their teeth. That became our aha moment, where we had to design a tool that would be so easy to use that more and more people would use it and effectively be able to remove the bacteria between the teeth that causes all the problems in the first place.
The importance of taking care of our body starts from the inside out. By implementing smart oral healthcare techniques, we can stop or prevent disease before it even occurs. The PerioTwist is a revolutionary interdental cleaner that is kicking outdated techniques out the window. Developed with antibacterial properties approved by the FDA and made with a plastic that will not harm your gums, this economically reusable tool can be used anywhere on the go.
So our goal was to make something very easy to use to clean between our teeth. So it took us 12 years of research and development to come with that high-tech design. So it's a one-size-fits-all tool. So no matter if the space between your teeth are big or small, it will fit. And you don't need a bathroom, you don't need a mirror, you just put it back in your cap and putting in your pockets, and you're ready to go.
Now that I have arthritis, flossing became so painful that I finally just gave up. Then I found out about the PerioTwist, and I can't believe how easy it is to keep my mouth clean. It fits in all the spaces, large and small. I have a lot of expensive dental work, and I want to take care of it, and the PerioTwist is helping me do that. I wish I had known about it a long time ago.
From the very first day that the patient starts to use the PerioTwist, we see a significant improvement immediately. They love the clean, squeaky feeling that they get. They're unaccustomed to it usually because they have not cleaned between their teeth in the past, and they're happy to do it, they're encouraged to do it, and it's a very effective result as we see right away.
To learn more about the future of oral care, please visit us online at periotwist.com.